I cannot stress enough how you need to download this app, play with the app, get very, very familiar, particularly if you're the only paramedic and now you're trying to run an arrest, and on a piece of tape on your leg, you're trying to figure out drug dosages and then the milligrams to mmLs, and on that, you're still trying to intubate, eye gels, defib, you're trying to run this arrest, your stress is through the roof. That's when errors happen, over or under medication. This app makes it so easy for you because you can go in and say, this is the drug I need. It's going to give it to you in mLs. It's going to tell you how much of that medication to draw up, how much to administer. It's going to take all of that potential errors out the window. Okay, so now that we've actually talked about when we open up that app, immediately finding that age of that patient we need and being able to quickly look at all the drugs, particularly the volume of that medication that we're going to administer, all that equipment, it's going to make our life a lot easier. But I'm going to show you some extra cool features that we have. If you click on the 3 white lines, it's going to bring you to a drop down. At any time, we can actually click and change a patient age. We can actually go back to that screen we saw a minute ago about our patient that we ran. Chart archive right now, we're not going to be using. That's just going to archive anything that's going to be stored. Right now, we're not storing anything. These training videos will be uploaded into this training section so you can go back in any given time and actually watch these little tidbits on, hey, how do we get this? I'm telling you now, once you get this app on your phone, play with the apps, play with the patients. If you go to patients that we've been playing with right now, and click the button, it's going to bring up the one that we were just using in this video. All you got to do is go to the trash can. Yes, I want to delete this. There's no record of it. It brings you right back to your first page. Click on the Add New Patient. But we're going to go through the 3 white lines. These training videos will be there, so play as much as you want. Just go back to that screen, delete it right off of your app. If you go to Additional Materials, that's going to give you the Hantevy guide instructions, which is about 2 pages. It's a very, very condensed version of what I'm talking about. But Handtevy did this one. You have a GCS, a burn, an APGAR, pain, and believe it or not, a WMD in here. So if you click this, you're going to start off with the GCS. It's going to have you the pediatrics 2 and under, the 3 and over. It's going to give you all the scores. If you scroll up, it's going to give you your whole rules of 9. So it's going to help you doing your rules of 9s. It's actually going to go through some of your fluid resuscitations, and then it'll actually tell you the palm method. If you scroll up again, it's going to go through your APGAR score. So after you deliver that baby, you can actually be able to do your APGAR score, and it's going to tell you, hey, this is that inverted triangle. This is the way we need to be treating that APGAR patient. Here's your flock pain scale and also the little faces they can point to. And at the very bottom is all your WMD stuff. In there is going to be your cyanide kit, and I'm going to show you an extra place where you can actually get to that. So once that's done, you're going to go back. So let's go to protocols. When you click protocols, it's going to come up with some extra drop down. You're going to come down with your cover, your table of contents. So in this case, let's hit your table of contents. And then all of these you're going to see on the very, very edge is a PDF. So if you click the PDF, it's going to give you a quick reference. So universal guide, quick reference, initial, IOs, airway management, anything like that. If you click the back arrow, you can minimize that if you need to. On your hospital contact numbers, we've got all the phone numbers for you and everything that you need. We're going to show you some other little features. Go to your quick drug reference, click your PDF. On here is all of the actual protocol doses. Remember, if you go back to that initial page and click your age, it's going to give it to you in volume. But for a quick dose, you can actually see for adult and the pediatrics. So adenosine, adult, first dose 6 milligrams, second dose 12. Pediatrics, it's 0.1 milligrams per kilogram. Second dose, 0.2 milligrams per kilogram. I really recommend on that pediatric you go back and put in that initial one so it figures it out for you for the actual volume that you're going to be administered. All right? So you can click back. And on here then, you can choose a section. So let's say we're going to go to medical quick reference. When you do that, you look down, you can actually choose any of our patients. So let's say we're going to do nausea, vomiting. We're going to do M13. So M13 at the very, very bottom. That's going to bring you up. Some of these are going to have 2 pages, but these are the protocols that we've used. So for nausea, vomiting, you got to have a patient currently nausea, vomiting in conjunction with a controlled substance administration. There's no exclusions. Remember, do your initial patient encounter. Remember, we're going to try to decrease discomfort, secondary nausea, vomiting. All responders are going to go here. Paramedics are going to be highlighted in blue. And the paramedics, you will actually have 3 choices depending on what you want. On some of the medications or the protocols, you're going to see in red, hey, this is the first drug that Dr. Nix wants to give. So in this case, he wants you to give Zofran. If Zofran's not working, you then have a choice. I can either do diphenhydramine or our new drug coming out, which I'll be talking about, is droperidol. We can click back. And on some of them, let's say the altered mental status, you're going to see a clipboard and a PDF. So let's say we're going to click the clipboard. On the altered mental status, this is some of the key indicators that you need to check off to make sure that I'm going down the right road for altered mental status. Did I check my blood glucose? Oh, my blood glucose is low, so in this case, it's going to be a diabetic emergency. I could X out and go to diabetic. But let's say you check off all the boxes. Okay, I'm in the right protocol. You can exit out and then go to altered mental status and click the PDF, and then that will give you your altered mental status protocol. On each of them is going to tell you that if I'm a diabetic, hey, you're in the wrong protocol, you should go to protocol medical number 10. Oh no, hey, my patient's potentially having a stroke. Hey, go to medical protocol number 21. So we can click back out of that. That's all your medical ones. We can minimize that, and you have this for everything. Airway, cardiac, medical, pediatric, trauma. If you click quick references on your documentation, this will actually tell you and get you back to being familiar, make sure you know how to do your controlled substances. Go back to documentation. You can do your controlled substance or how to document an image trend, because remember, if that transport capable rescue ends up having to transport, you might want to refresh on this to make sure you're dotting our I's and crossing our T's. If you minimize that, the drug reference to me is a very, very good one to refresh and look over. If you notice here, this has all the drugs in alphabetical order. You can actually click, let's say we're going to do the cyanide kit. We come over and we click on the PDF, and there's your cyanide kit. It'll actually tell you adult and pediatrics. If you go back to your pediatric, your cyanide kit was on there, and it actually tells you exactly how much you're going to give. So once again, on the pediatrics, very important. First screen, click that. It'll show your drugs that you're supposed to give. And then procedures or protocol information or structure. Once again, once you get this app, you need to play with it. Get yourself familiar with it, know where everything's at that you can get to in that stressful moment to make your life so much easier. Take that stress off of you. Click on the 3 white lines. Contact and help privacy policies are just some little tidbits there on, hey, you're having issues with the apps. If you have issues with the apps, contact the EMS division. They're going to get you in touch with IT and fix it. All right. Only thing after that is you can go play around with the settings. When you click on settings, you can actually go adjust the font size for you. You can do profile. So under settings, the most important thing here, I'm going to show you in a second, is the CPR button. I showed you how in the middle of that cardiac arrest, you're trying to turn off sound, turn off the lights, telling her to stop. Oh, ventilate your patient, check your patient. That is only for that call that you're turning stuff on. If you go to settings and you click on CPR, you can actually turn all of that off permanently for your phone. So you can make a decision beforehand, I don't ever want to hear any of that on any time I push CPR, and you can actually shut them all off, or you can shut it off per patient encounter. It's totally up to you however you would like to run the call. This, by turning them off and saving them, permanently disables that in the app for any time you push start CPR.